out of your nose and mouth. Wearing a face covering over your nose and mouth reduces the spread of droplets carrying the virus. This means if you have it, you're less likely to pass it on to others. Larger droplets can land on other people or on surfaces they touch. Spreading the virus through droplets is most likely to happen when you are less than 2 meters apart. Smaller droplets, called aerosols, can stay in the air for some time, especially if there is no ventilation. So when you are with people not from your household, you must keep at least 2 meters apart. The risk of spreading the virus through smaller droplets is much less outdoors, where there is more ventilation. Wash your hands, cover your face, make space. These are the 3 most effective ways we can all control the spread of the virus. Remember, if you have any coronavirus symptoms, high temperature, a new continuous cough, or a loss or change in your sense of taste or smell, get a free test by calling 119 or visiting nhs.uk. Together, we will control the virus and stop the spread. Don't forget, hands, face, space.
Good afternoon, everyone. My name is Steve Maddern. I'm the Director of Public Health at Swindon Borough Council, and really delighted that you can join me for another live Facebook Q&A from the offices in Swindon. So thank you, before we start, to say a huge thank you to everyone of the residents for everything you're doing to prevent the spread of COVID across our town. We have seen across the last 4 or 5 weeks that the case numbers have reduced quite substantially, which has seen a positive change to our status on the national watch list. So we've now gone back to an area of concern, and we're hoping that if we can continue with the downward trend of cases across Swindon, that we will then be able to see ourselves coming off the watch list very soon. The key thing to remind ourselves here is that although the case rates are reducing, it's not a time to become complacent, and we really need to make sure we're doing everything we can to reduce the spread of COVID across the borough. Before I go into the resident questions today, I just want to raise a quick point around issues with access to testing. So currently we are aware that there are issues for some residents being able to gain access to testing in Swindon or within the locality. Across the last week or so, we have seen over 4,000 people being able to access testing locally across our 2 main testing sites, and over, or just shy of 800 people have managed to get hold of postal test kits. So people in Swindon are being able to access testing, but we are very much in having concerns around the national lab testing capacity that has an impact on Swindon as it does on the rest of England at this time. And we are working very closely with our regional and national leads at the Department of Health and Social Care to make sure that we are able to try and access as much capacity as we can to support the needs of our Swindon residents. You'll be aware that the County Ground Mobile Testing Unit has moved to the Civic offices as of Saturday gone. And just a reminder to anyone that has booked to access testing at Civic is to remind you that you need to come through the Beckhampton Street entrance, and then you will be exiting onto Euclid Street. Don't come into Euclid Street because that's the back of the testing site. As of today, Broad Green Community Centre is also another testing site which brings us some extra capacity to Swindon, which is really, really important as we use testing to help us tackle COVID across the town. The key thing to remember is that these sites are either drive-through or walk-through sites, but they are not walk-in sites. So it's really important that you must book before attending these sites. They will not test you unless you have booked. If you are struggling to obtain a test through the online portal or by calling NHS 119, then I just urge you to keep trying. They do release new appointments throughout the day. This is a nationally delivered programme on behalf of the government, delivered at a local level, and we are doing everything we can to try and provide that capacity at a local level. And we hope as the weeks go on that that lab capacity will increase so that we can increase testing. Also really important to only test if you have symptoms of coronavirus and not to repeat test either. So if you've had a test, you don't need to test again. Okay, the final thing to just remind you is also if you are seeking information and advice regarding testing or coronavirus, then the number you do need to call is the NHS 119 number. Don't call the NHS 111 number, which is for wider health conditions. We're seeing an increase in calls to the service at this moment in time, and it's really important. If it's related to coronavirus, call NHS 119. Thank you. Okay, so I've got a range of questions to answer for you today, so let's get started. So the first question from Jenny on the topic of testing has said, well, isn't it just why don't we just test everyone? So we always use a testing strategy that's in line with current science and evidence, and we know that actually it's more effective to test people that have symptoms of coronavirus rather than testing the whole population. At this moment, capacity wouldn't allow for that to happen anyway, but we're very much guided by the science. So again, only test if you have symptoms of coronavirus. Joanna wants to know, can I explain what the rule of six is? And Christina wants to know how are bubbles affected by the rule of six as well. So I'll try and answer them together. So as I hope you're aware, as of Monday the 14th of September, it is now against the law to meet with people that you do not live with in groups larger than 6. So unless you are meeting in a household or as a sport bubble. The police have powers to enforce these legal limits, and they could issue fines, which range from £100 up to £3,200. These new rules apply to you in your home, indoors and outdoors, and places such as pubs, restaurants, cafes, and public outdoor spaces. It doesn't apply to schools or workplaces and a number of other situations. And if you are inquiring about exemption to these rules, then you can find them on the gov.uk website. Okay, the next question is from Gary, who said, who's going to monitor the pubs and restaurants to see if they are recording details and sticking to the rules? Well, Gary, I think it's really important that the businesses themselves are self-policing. So the new requirements around test and trace is a legal requirement for them to do now, and all businesses should be working in line with legal requirements. As a local authority, we engage with those businesses through a public health, environmental health and licensing perspective, so we can hold them to account through those measures as well. But also we can engage with our police colleagues should there need to be stronger reinforcement. The key thing is that enforcement is always the last thing that we'd want to do, because we'd really rather work with people to encourage them to comply with legal obligations or guidance. Okay, so Lucas wants to know what is being done locally to help people that have mental health issues during this pandemic. Now, we know that mental health is really important and that the pandemic itself may have exacerbated some mental health issues for some individuals or created new ones, given the change to the situation and such uncertainty we face in the world at this moment in time. So we do have a broad range of mental health services across Swindon, including psychological therapy access and lift psychology services that can be accessed through your GP. And we also work very closely with our third sector or voluntary organisations such as the Swindon and Gloucestershire Mind. Ipsum and Twigs are also available in a virtual format to be able to provide you with help and assistance. There's also information on the swindon.gov.uk website, which can signpost you to some online resources to help you with your health and well-being in relation to COVID and lockdown. So Elizabeth wants to know what's happening with the dentists and when are they opening for NHS patients. So dentists can operate where they are able to operate safely, and dentists have resumed service, as much to my knowledge. If you're seeking an NHS dentist, then if you go onto the NHS Choices website, you will be able to find a list of NHS dentists in your area. Andy basically says the case rate is irrelevant, and I know I talk about the case rate a lot, but it's the fatality rate that matters now. Well, actually, I think they're both important, Andy. The case rate is important, but we use a whole range of different data in public health to make sure that we can support and protect the health of the population. Case rate is an important indicator because that also is the indicator that the government uses to determine where areas need support. We also look at case numbers, we also look at deaths as well. The fatality rate that you mentioned is important, but we know that the fatality rate has declined substantially since the first wave back in April. But again, it's just really a reminder that this isn't a time for complacency, because without keeping the measures in place, without preventing that spread, particularly to the vulnerable people in our communities, that's the only way that we're going to keep the fatality rate down as well. So I think they're all important. So Tom wants to know, what work are your team doing now to prepare for winter? So the health cycle, the public health cycle, always thinks about what's happening next, and winter is always on our agenda in planning for it. We have a long history of preparing for winter, and we do that by engaging with many organisations across Swindon to make sure that all organisations are prepared for what winter brings. Usually our main concerns around winter tend to be flu, tend to be other situations like norovirus. This year we have the added complication of COVID as well. So we very much need to work closely together to keep the case numbers low in regard to COVID, to protect our vulnerable in the community, to make sure that our services are ready and can cope with any additional capacity that they need to have during the winter time. It's really important to highlight that flu is amongst us this season, as we will see COVID and other diseases. So it's more important than ever to stress that if you are eligible for your flu vaccine this year, then I really strongly encourage you to get vaccinated. Not only does it protect you, but it protects those around you and your broader community. So please, please do take the opportunity, if you have access, to get the flu vaccine this year. Along with local plans, we know that the government will be launching a national winter plan across the next couple of weeks, which will provide extra support and guidance to local areas in preparing to manage COVID, but also wider winter illnesses as we go into autumn and winter. So Chris wants to know what tests will be available to tell the difference if someone has a winter cold or whether they have COVID. So this is really tricky, and I think we're seeing this with our, as the kids go back to school now, is that autumn is naturally a time for change of season, and we start to see the winter coughs and colds settle in. I think it's really important, again, to highlight, sometimes it's very difficult to differentiate between certain conditions like colds, flu and COVID. They all come from the same virus family, so they may have some similar symptoms, such as a high temperature. The key thing here is, if you're experiencing any illness, it's probably not best to go to work or go out into your community. But if you feel that you're experiencing any of the COVID-related symptoms, so that high temperature, that loss of sense or smell or taste, or that new persistent cough, it's really important that you self-isolate and book for testing and be persistent with trying to get that test. The next question comes from Justin. So Justin wants to know, when will the Test and Trace app be launched? So the app is being developed by the government, and we know that it's been piloted in Newham and on the Isle of Wight. And we know that this nationally launches on the 24th of September. This app will basically have a QR code reader, which you'll be able to use in pubs, restaurants, cafes to check yourself in. What that app will then do is it will then alert you if you have come into contact with someone that's tested positive. It won't tell you who, and it won't tell you where, to protect the privacy of the individual, but it will give you the information that you then need to be able to self-isolate. To explain it a little bit more, we'll show you a very quick 1 minute video, or hope to show you a quick 1 minute video explainer about the app.
The NHS Test and Trace app is a vital part of the NHS Test and Trace service. Now based on Apple and Google's privacy-preserving technology, The app will help us safely get back to the things we love, protecting you and others. If your postcode district becomes high risk, the app will let you know and give you advice on what action to take. And if you come into close contact with another user who reports a positive test result, the app will send you an anonymous alert. A built-in QR scanner lets you check into venues quickly and easily. You can check your symptoms in the app, and if they suggest you may have coronavirus, the app is an easy way to get tested. Any data shared with the app is held on your phone. Nobody will know who or where you are. You can delete the app and all data at any time. You don't have to use the app, but the more of us that do, the quicker we can all get back to the things we love. Let's get back to the things we love. Let's get the app.
Okay, I hope that gave you some further information. That video is also available online should you wish to watch it again. Okay, so moving on then. So John wants to know, what is your team, what is my team doing about enforcing mask wearing in shops? So the public health team at the council has no enforcement powers, and there's very limited enforcement available across the local authority to enforce people to be wearing masks in shops. It is difficult, and we know that there are exemptions involved in not wearing masks. I think it's really important to highlight that it's really important to wear a mask in those places where you should be wearing a mask if you're not exempt, because it helps you to protect other people. The mask is about stopping you passing things on to other people. So you do need to think about yourselves, but also your wider community. Other people are wearing masks to protect you, and you have a civil duty to protect those people around you by wearing a mask if you are eligible to do so in those places which are expected. In this situation, we're talking about shops, but you also need to be thinking about public transport as well. Again, really important. If we don't play by the rules, we'll see that increase in cases. So if you are eligible to wear a mask or face covering, then please make sure that you do so. And when you are wearing it, again, make sure that you're covering both your mouth and nose. That's really important. Cover your mouth and nose and wear it where you should be wearing it. Okay. So the next question comes from Leanne, and Leanne wants to know, why are children being sat next to each other in class? Shouldn't they have a space between them? Well, yeah, absolutely, Leanne, they should. So the guidance does say that children should be seated with safe, socially distanced space between them, and all schools should have a risk assessment in place to make sure that they're keeping their children safe and protected whilst at school, but also their broader workforce as well, so the teachers and support staff. If this isn't the case, then please do let us know, because we can always raise that with the school to make sure that they are able to follow the guidance that has been set out for them. So my last question is from Nick, and Nick wants to know, what should people who are shielding do now that the case numbers are rising? So I think there's a couple of important points here. So I think the first point is, although we're seeing that national increase in cases across England at this moment in time, the case rate for Swindon is lower than the national average and actually continues to decrease. So that we are not seeing the numbers that we're seeing across England as a whole, and across the southwest tends to be generally lower, as it has consistently been since the start of the pandemic. I think the second point is to highlight that the national shielding programme that was in place during lockdown is currently suspended. So those people that were shielding no longer currently have a reason to shield unless being advised otherwise. People that have shielded with this CISA programme are able to go out and about in the community as anybody else is. But again, just really important to reinforce those messages around social distancing, wearing a mask where you should be wearing a mask, and making sure that you're keeping those hands clean. That's really important. Okay, so I've come to the end. So finally, it's just me to sum up on some clarification around self-isolation. So I just want to clarify that if you are a contact of a confirmed case of coronavirus, then you must self-isolate for 14 days. It's really, really important. You do not need to test unless you develop symptoms, okay? If you don't have any symptoms but you choose to test anyway, One is you're creating an impact on capacity and depriving someone of a test that genuinely needs one. But even if you test and you come back negative, you still have to self-isolate for 14 days. So just to reinforce that, if you don't develop symptoms, do not test, but you must continue to self-isolate. So that brings me to the end. It gives me an opportunity to say that I hope that you find these briefings useful. Please let us know what topics you would like us to cover in future sessions. We've done myth busting, we've covered education, we've covered a whole range of different topics, but if there's anything in particular you would like me to update you on, I'm very happy to hear from you in what you'd like to know about. Again, just to reinforce, we are seeing that squeeze on testing capacity at this moment, so only book a test if you have COVID symptoms, and if you are unable to book a test on your first try, then please, please, please keep trying. Always wear a mask, keep washing your hands, and just make sure that you're keeping that space. Until we speak again, thank you very much everybody, have a good evening.